Good morning. It is another Friday, and every week I say we've had a big week, and every week it's true. This week and weekend, we are anticipating that there will be some movement on the reconciliation bill. So I want to kind of take you through what we know as of this moment at Friday at 9 a.m. Things have been changing roughly every 5 minutes. I just want to make sure everybody knows that we are talking as of 9 a.m. on a Friday. And that we should be expecting that we will continue to see developments evolve over the weekend and into next week. First, just a little bit of what's been happening around the state. Last week we had a in-person event in Iowa County talking about the ripple effect and how these Medicaid cuts would impact unpaid caregivers. Wasn't hugely attended, but the conversation was really good and important. And we did have a reporter who did a really nice piece about that. So you could check out the article, pretty long piece, probably something where you go, yep, that sounds like me, and you might want to share it. I think that in addition to the points that are on the screen here, one thing that was really interesting, we had a lot of folks from our local aging and disability resource centers that were there. And those people are just so valuable because they are the folks who are interacting with everybody who comes through the door who's looking for some kind of help. And they manage a lot of, not only the screening and the options counseling for our waiver programs, Family Care and Iris, but also people who are looking for caregiving help, or are finding that there's a person that needs more help than they had before, and what are my options? And so they had a really interesting perspective on how many people like walk through the door expecting that there will be some way that they can get some assistance, some in-home help to keep an older relative at home, that what they need is just to know what to do, and then they'll be able to find the help they need. And of course, this group of people knows that that's not the reality, that we've been faced with a paid caregiver shortage for many years now, that really limits how much help there is to hire, even if you have the money to do so, and that there are a lot more people that have needs than there are workers to provide them, and that frequently what happens is that the unpaid caregivers are the only option. And so it was a really good reminder of just how many people are about to live the reality that is very familiar to some of us who have been in disability world and aging world for a long time, and kind of really know how we have a system that is not perfect right now, that doesn't actually provide all the help that people need, but it provides enough where people can kind of get by. There's a whole world of folks out there who are about to find that out. And they are entering into a place of needing help at a time when the cuts that are being considered at the federal level will directly reduce how much help there actually is. As you're thinking about how to talk to, to use your experience to talk to people who maybe are not aware of what does it mean when you need some help that isn't there. This was a great reminder. And a lot of our ADRC folks were also very worried that, when people need help and it's not there, oftentimes what happens is they just go without help. And so there were some really interesting conversations about kind of after effects of, we're really worried that Adult Protective Services is going to start getting calls and discovering people who are really in bad condition because they haven't been able to get that help. So really interesting conversation and article, and I'll be sharing an article that was published nationally by the governor of New Mexico who last week, who was saying very similar things about how many unpaid caregivers really rely on Medicaid to supplement their own care work and what it would mean if there was less help from Medicaid. Um, a lot of you out there are doing some great work contacting independent reporters and really making the connection for people about how Medicaid has helped you create a meaningful life for yourself or people that you love, and what it would mean if any of those parts shifted and changed. And I think that this is a good example, and it's so important and a part of our advocacy from now until forever, really. But for the immediate future, it is going to be so important to practice these skills about how do we connect. Here is the policy change that happened, and here's the impact on people's lives. We are going to have to be the connectors to help people understand what the actual impact of changes are. And this is a great example of somebody who has really worked very, very hard to use the tools at hand to kind of cobble together something that is manageable and good. And it wasn't easy. So again, our current system is not easy. It takes a lot of effort on the terms of people with disabilities and family members to to be able to work through the system to create, kind of a stable life. And I think that's also a good message, is that it isn't easy now, that this is a manageable system we have now, and anything less just is going to make things harder or maybe impossible for some people. We also have a virtual panel discussion. This was a couple weeks ago, but the panel just got posted on YouTube. So if you are running low on videos to share with your group, or want to spend some of your July 4th vacation time, recreating and listening to people talk about disability issues, this is your chance. If you haven't seen this documentary, it is about all of the advocacy that went into passing the Americans with Disabilities Act. And it's pretty well done. I think one of the takeaways that is important for us in this particular moment is that it really shows that people with disabilities had to have a vision and a policy vision and really fight to create something that did not exist. And that it took a really long time and a lot of people doing many small things. Everybody contributed something, whether it was licking stamps and mailing out typed action alerts, because that's the era they were in, or people behind the scenes working tirelessly with Congress or helping write the bill, and frankly, people who were using direct protest. All of those things were important to kind of convince Congress, who would have been very happy to remain in inertia, so that, this is not a new problem, to take the step and actually pass a bill. And I think the moment we are in now is that, we have some things that we could lose or take a step backwards. But that important piece of having a vision of how things could be better is an important reminder that even in this moment, where maybe things are not going to get better for a while, it is important to remember that it's up to us to have a vision of how we feel our lives should be, and that, even in a time where there could be a step back, um, we are always the ones that are going to be able to best show how to get to a better future. So it's a good documentary. For those of you who have PBS, it is on public television, and it is on, I believe, on YouTube as well. If you're looking for it, and this is the panel where the director and some folks from around Wisconsin, who have some historical perspective, talked about, not only the film but also, the main points of advocacy, that I think are very relevant to today. All right, let's dig in. Congress, they're doing stuff. Some of you may have heard about this quote that Senator Mitch McConnell apparently said behind the scenes in a closed door meeting, and it was reported out by Punchbowl News. Apparently, they were talking about the reconciliation bill, and his statement was, look, failure isn't an option. In other words, we need to pass this bill. And I know a lot of us are hearing from people back home about Medicaid, but they'll get over it. So let's break that down a little bit. First of all, the positive piece, they're hearing from a lot of people just like you. They meaning US senators, and that means people like you from all across the country. And they've been hearing from you for a long enough time where every senator, and for a long enough time and from so many people that they can't ignore that they've been hearing from you about Medicaid. But the second part of that sentence, but they'll get over it, is really where I want to focus, because this is a clear statement
Esta es
about
una clara
what lawmakers
afirmación
often think.
sobre lo que a veces piensan los legisladores.
I'm hearing
Oh,
Julio.
oh, sorry, Jeremy, I'm not an interpreter. I assume I was.
Apologies on that, Julio. You're good to go.
This is a common thing that lawmakers often calculate when they are passing legislation. They know that it is hard or difficult, or that many people do not follow what kinds of bills are being passed, and that it gets hard for people to understand that a change in policy that they don't fully understand or don't know about actually results in a tangible thing that impacts that individual's quality of life. So when he is saying they'll get over it, he's actually saying all those people who are contacting you are going to forget about what's in this bill, and they won't trace it back to us. So don't listen to them now and change the bill, because they aren't going to remember. It isn't going to matter. And in some ways, he is saying that based on experience, because some bills, including this one, are designed to be hard to understand. And they're designed so that people won't necessarily experience the consequences of the policy changes in the bill right away, right? When we have talked about implementation deadlines, even a quick implementation deadline of January 1st in 2026, which is, when some things will go into effect, well, that is 6 months from now. And some implementation deadlines might be in 2027 or 2028. So they aren't wrong in thinking about people. The more time and distance you place between the passage of a bill and when the negative impacts really start happening in people's lives, the more likely it is that people will not be able to connect the negative impact to the bill itself and to the people who passed it. And they're counting on that. They're counting on people forgetting that the bill that they're passing today is going to be the reason why state Medicaid programs are being cut, why food assistance is changes for people, why they lose coverage or their marketplace premiums go up and then up again. And if people forget that this bill is the reason for those things, then lawmakers have some time and space to get their story straight and perhaps convince people that they're not responsible for all the things that are making their lives harder. The good news is there are a lot of people just like you who are contacting their lawmakers with concerns about Medicaid. And for most of the people who are engaged on this webinar, you are people who are heavily touched by Medicaid, whether you are relying on it for home and community-based supports, or you have an older relative, or you're an unpaid caregiver, or you are a small business who is providing care for people. You are the folks that will likely feel these changes first, and you are aware of what this bill will do. And that means that not only you, but many other people across the country can continue to connect the dots for everyone else in the months and years ahead. And that is really a critical role that we cannot underscore enough. Some of these changes are like that we have been talking about the impacts of for months, may in fact become law. And that means that our job just becomes different. Our advocacy shifts to a different focus, but one thing that will never change is the need to help connect the dots for people who haven't been paying attention now, and who will be feeling the impact of these changes in the future. You are the people who are already prepared to do that and to help others become prepared to do that as well. This slide gets changed about 5 times every day. So you might remember a little over a month ago, the House passed their version of the reconciliation bill. We are now at the place where the Senate is going back and forth about when do they want to vote on their version of the bill. Last week, we covered what are some of the changes that the Senate has made to the House bill, and many of them actually make some of the provisions the House had worse. We also know that it is unlikely that we will see the legislative text and all of the changes that have been made beyond what we saw last week before the bill really gets a vote. Let me back up. This week, the Senate parliamentarian has had a big role in reviewing all of the language in the bill and taking challenges about certain parts of the text. And her job is really to say, okay, does this meet the criteria called the Byrd Rule of what can be allowed in reconciliation? We'll talk about some of her rulings in a little bit. But what has happened is that essentially the Senate has continued to revise this legislation and have new ideas and have different things that it may or may not insert in this bill that we don't fully know about because it isn't in the text yet. Senator Thune originally wanted to start voting on this bill this Thursday. That got pushed to Friday, today. There is some rumor that we might see full text of the bill as late as tonight, Friday night. And now it seems like the Senate is preparing to vote on this bill this weekend, at earliest on Saturday, but possibly on Sunday. What we should expect is that the full legislative text, there's no requirement no time frame that the Senate has to, publicly unveil that legislative text before they vote. So unlike the House, and other places where, like, say you have to have the text you're voting on 24 hours in advance, there isn't that in the Senate. So it is likely that senators will be getting the text of the bill that they are voting on almost in real time with when in that vote is supposed to start. We should also expect that the text that is introduced to be debated and talked about on the floor will be changed, that there will be amendments on the floor called a votorama. And ultimately what that means is that whatever the Senate is doing, it will be unclear what they've done until after they have passed the bill and we can see what the actual amended text looks like. And then it seems like the House of Representatives could be ready to take up the Senate version of the bill and set it up for a House vote to pass it next week. Remember, the Senate version and the House version have to have the exact same language, and then the bill could be sent for the president's signature, which would meet this July 4th deadline that they have been very intent to meet. Now, I'm going to say this, generally weekend votes are not particularly common, especially on a bill of this size. And strategically, making sure that you are passing a bill on the weekend when fewer people have the ability to have eyes on it, and that you are passing a bill on a holiday week in which many people are taking vacation or have time off, that is a strategy, okay? So we should see it as a strategy. It is also possible this all falls apart and we get a delay, in which case that could be really, really helpful to us, because it does seem like the more people who are learning about the bill, when they know what's in it, they don't like it. So let's talk about the Senate parliamentarian. For the nerds, they've gotten very excited this week. This has been like big news. The Senate parliamentarian is really trying to see whether what is written in the bill right now conforms to this strange Senate rule called the Byrd Rule, named after a Senator Byrd, that has some very specific criteria of what can you put in a reconciliation bill. And remember, the reconciliation bill is special because it only requires a simple majority to pass, rather than the normal 60 votes it takes in the Senate. The Senate Republicans have 53 senators who are Republicans. So if they want to pass legislation using only Republican votes, there is a real advantage for them to use the reconciliation process, because there's only 100 senators. So a simple majority is 50. And the vice president can also have a vote to break the tie. And since the vice president is also a Republican, conventional wisdom would be that's your 51st vote. So it becomes really important for all of the, text of the bill to pass the Byrd Rule, because that means that they can pass it with only Republican votes. They don't need to have 60 votes. They need fewer senators to agree to something to do it. And there have been some rulings and on some provisions that are of concern to us, that the parliamentarian has said, no, this doesn't pass the Byrd Rule. One of those provisions was the amount of match that states would have to pay in order to continue food assistance programs. That wasn't written in a way that the parliamentarian said was okay. And there have been a number of things as of yesterday afternoon related to Medicaid that she said, no, these things aren't they aren't written in a way that would let you pass this language with only 50 votes. You'd have to have 60, so it can't be in a reconciliation bill. The main thing that is being talked about in terms of Medicaid hangups, it's not the things that are of major concern to us that impact ordinary people. In other words, there doesn't seem to be an argument about work requirements, about checking eligibility more often. The main sticking point seems to be provider taxes, the amount of taxes that are leveraged on hospitals and nursing homes and rehabilitation facilities that then states use as part of their required Medicaid match. And then what states do is they draw down the federal dollars and raise the rates for the facilities that they tax. So when they serve Medicaid patients, they get a higher payment for doing so. The Senate tried to make a much more stringent tax provision than the House did. And the parliamentarians said, that's not going to work. There are also a lot of provisions that she said are not okay, that impact coverage of people in Medicare and Medicaid who are maybe legal immigrants and have some sort of legal status, but are not citizens. And there are a couple of things that are of importance to our community that she hasn't ruled on yet, and maybe those rulings will come today. Specifically, repealing administrative rules that make it a lot easier for people to get in or stay in Medicaid or get in the program that helps people pay for Medicare premiums and the nursing home staffing rule. So there are still some rulings that could happen. So what does that mean when the parliamentarian says, this language isn't going to work and if you want to pass it with only 50 votes? Congress has options. First of all, what it does do is slow the bill down because Congress has to figure out what to do. So the fact that we have not seen this bill voted on as of yesterday, Thursday, is a reflection of, oh, we now have some issues that we didn't know about that we have to resolve. And the fact that we're not seeing a vote on Friday, these rulings have at least delayed action on this bill for this whole week. And she's not done yet. So by creating problems that the Congress has to figure out how to resolve, that does stretch, it takes time to do that. Now, there are a few things that Congress could do, or the Senate could do. They could say, oh, this provision doesn't work. Maybe we just don't do it. Maybe we just remove it from the bill and then we don't have to think about it. That's one option. It could mean that they need to rewrite the provisions a little bit so that essentially they get to the same outcome, they get to the same savings, but they pass the Byrd rule. And this does seem to be the approach that has been taken with the SNAP provision that would require states to pay a matching rate and ties the amount of match a state has to pay to their error rate. The way they made that be okay with the Byrd rule was to adjust the timeline on when do states know what their error rate is, and to calculate the error rate over the past 3 years, not every year. So those sound like very small changes because they don't substantively change what that provision is going to do. It's going to make a lot more, mean that states have to pay a lot more money potentially in order to get that federal food assistance aid. And it doesn't change any of the other provisions that were impacting SNAP that, again, would impact real people. So I want people to understand that even though these parliamentarian rulings are are slowing the bill down, it doesn't necessarily mean that the things she's flagging are going to be removed from the bill. It also could mean that the Senate decides, okay, if there's something that we were going to do and that was going to save money, in order for us to pay for our reduced revenue because we're not collecting as much taxes, maybe we add new cuts to get to the same outcome. And certainly, you know, the provider tax change, that is a change that would really, the Senate is counting on to save a lot of money. So if they do something different, you know, either change that provision so it doesn't save as much money or remove it altogether, which I think is unlikely, that means they might feel the need to make up for, you know, and make further cuts so that they get to the same amount. So, you know, there's all sorts of rumors about what kinds of ideas they might be considering. We will not know what those are until we see what is in the legislative language and see what the amendments to that language are. The other option, so-called nuclear option, is they could ignore the parliamentarians' rulings. And there's certainly a division of opinion on that in the Senate right now. Senator Thune, who is the majority leader, has said, no, we are not going to just set aside her rulings and not deal with them. But there are certainly senators who they don't like what she said and have publicly, you know, called for just ignore her. And that has been done in the past. I believe in like 1975. It doesn't happen often, but it does happen. So all of these things are options, and I'm spending a lot of airtime on it only to say to get you to the point where there are tweaks that are happening to this bill now that aren't changing the substance of the cuts that are happening. They may be delaying things, and maybe we will see some things that were in the bill taken out and new things we don't know about added, but the intent to pass the bill is still there. Overall, yesterday's rulings on the Medicaid provisions that she said didn't meet the Byrd rule, that's about 250 billion to 400 billion in cuts when you add all those provisions together that don't pass the Byrd rule. So they have to figure out how to either change those provisions or add more to if they want to get up to that level of savings. The Senate is feeling a lot of pressure to get this done fast. This bill is like a dead fish out on the hot August sun. The longer it's there, the more people notice it, and it's not a good smell. So they are trying as quickly as possible to move this bill and pass it so that the focus goes elsewhere. And in some ways, they're trying to also do that so their members don't know what they're voting on, right? You're not providing your own membership with the final legislative language until they're actually on the floor prepared to vote for the bill. This is a very similar strategy as the House used. When you think about the 2010 legislation that established the Affordable Care Act exchanges, where people with pre-existing conditions could get insurance and all of those things, Obamacare, as it's typically called. They had a year full of debate on those changes. There were like 5 committees that had hearings on it. It took a long time to get to the point where that piece of legislation moved from, you know, its first draft to something that President Obama at the time signed. This bill in the House went from first draft to final draft, passed by the House in 5 days. The same thing is happening with the Senate. where in under a month, they are tweaking the House bill and making tweaks to the text as they go. And they're trying to pass something that no one has ever seen over the weekend in 2 days on a holiday weekend. So we should just be expecting that there's a lot of things that we think we know now that may change. And it also means that the Congressional Budget Office will not have any analysis on what the Senate changes from the House bill actually mean before the Senate passes this bill, if they are successful at doing that this weekend. They want to hurry. And their reason for hurrying is not because the merits of the bill, the merits of the bill. Their reason for hurrying is because they know that people don't like this bill and they have to pass it before too many people really don't like it. They want to hurry. Our job is to slow it down. So I don't want you to think that this is inevitable, because it isn't. Sometimes it is a strategy to kind of portray, oh, well, this is going to pass, to get people to give up. This is really shaky. There's a lot of senators who do not like different parts of this bill for really different reasons. There are a lot of House members who are publicly saying we don't like this for very different reasons. And when something's shaky and you keep pushing on it, you can make it fall apart. And that's our advocates' role right now. We have to continue pushing, because we can't accept that the Senate saying this is going to pass is truth, because it isn't. They haven't taken any votes yet. And I'm just going to throw out there, one of the options that they have, since everything in this bill is a choice, they could choose not to make Medicaid cuts. They could choose not to make SNAP cuts. They could choose not to do some of the tax ideas that mean less revenue is coming into the government. Everything in this bill is a choice. So, whatever language remains in this bill that impacts people like you and me, who are concerned about Medicaid and food assistance, if those changes that hurt those people are in the bill, that is a choice and that is intent. And our job is to really push as hard as we can right now to delay it and make it fall apart and let that dead fish that's out in the August sun sit there for another week or two. There are some lawmakers who are looking for cover right now. And I don't know if this is happening to you as a constituent, but certainly our national people are talking about some common strategies that lawmakers use that maybe they might ask you about. Some folks are being asked, like, hey, tell us which provision you're most concerned about. What they're trying to do is to identify some small thing in the bill, some small thing that needs to be changed, that if they just did that one thing, they could say you supported it. There are a lot of provisions in this bill that are really harmful for many people, including people with disabilities. So it isn't helpful to just say, here's a small selection of provisions and allow the legislator to kind of placate you and say, well, if we just made these small changes, then you'd be okay with it. This is not a salvageable bill. And everything that is in this bill is a choice. So don't fall for this strategy. In fact, I got asked this by a legislator this week. Well, how would you make this bill better? And I was with another advocate, and our answer was, this bill is unsalvageable. There is no making a really bad bill better. There's no making a bad bill less bad. It's still bad. This bill is unsalvageable. It does not solve any of the problems that people like you and like me would identify as issues in our healthcare system. It doesn't, get more paid caregivers to be able to help at home. It doesn't help people who would like to live independently in their own apartments be able to do that. It doesn't, make increase the capacity of providers or lower costs of care, or any of the things that probably we could sit around and come up with 10 things that we would say, hey, these are issues that really need to be dealt with. It doesn't do any of that. It does add more problems, and it does mean that 16 million people are potentially going to lose the health care we have now. So again, remember, this could all fall apart. And most of the maneuvering that you're going to hear about this in the last several days is all about the Senate looking for the right combination of magic words to get to 51 yes votes. And that means the language could change and be changed again. And the House has to agree to those changes. There are some rumors that the Senate may even include a provision in its bill that would prevent the House from making any changes because they're so worried that the House might not want to do an up or down vote on what the Senate does. All of that is code for this is a real opportunity for advocates to keep pushing, because if it isn't forced through fast, it may not pass soon. And if it doesn't pass soon, then there's more and more pressure to take out the things that are problems and make this bill at least less bad. So I kind of boiled this down. The bill doesn't address any of the issues our current health or long-term care systems have. It cuts $1 trillion from our healthcare system and causes probably at least 16 million people to lose healthcare coverage, at least the House version of the bill. And remember, the Senate version has changed it to make it, more strident than the House. Targeting Medicaid targets everyone in Medicaid. There isn't a way to protect certain people or only hurt certain people. And the people who need the most care for the longest time and are the highest cost are impacted by the least change. You've heard us talk about these 5 things in webinars since January. And I think that last orange circle is really where a lot of our folks are. You know that when there are Medicaid cuts, it doesn't take very many Medicaid cuts to have a big impact on people's lives. And the next few slides are going to kind of go over some of the studies and other things that have been publicly released in the last week that are going to validate your experience. The Congressional Budget Office responded to a senator letter, like an inquiry, because, all of these lawmakers who tell you they don't know what's in the bill, it's because they're not reading it, and they have staff and they have other people they can ask. That's their job, to know what's in the bill. And the Congressional Budget Office is one of the places that helps lawmakers understand what the provisions that are in a bill actually mean. And 2 days ago, the Congressional Budget Office confirmed, the provisions as they're written in the House version of the bill, and remember the Senate version is worse, will mean that states will cut optional services, reduce provider rates, or find ways to make sure there are fewer people in Medicaid. This is something that we have been talking about for the last 6 months, but now you have an independent source that says, yes, this is the likely result. This is the likely thing that states will do if this bill passes as it is. And remember, optional and services include things like home and community-based services, home health, personal care, prescription drugs, lots of the things that people with disabilities and older adults really use the most in Medicaid. There's also been some reports that have come out that have showed that, yes, when there has been less money, Medicaid money going to states, that in fact, the things that we have been talking about and worried about, cuts to the optional services, that is what states do. You can look at the full report online. There's a link here. I just copied the graph. But again, if you're looking for some, validation that the things that you are worried about are in fact, there's some evidence that they happen, this is one of those pieces of evidence. You have this Congressional Budget Office saying, yep, this is what states are going to do. And here's some evidence of past behavior that shows that when federal Medicaid spending goes down, what most states do is cut the highest cost services. And that happens to be services for people with intellectual and developmental disabilities. We have family care and IRIS waivers that cover people with IDD as well as physical disabilities and older adults. Many states have specific waivers that are only for people with IDD, which is not better, by the way. And you can see that that's where they're going when they need to reduce their Medicaid budgets. Personal care, home health, these are all the things that people with disabilities and older adults use the most and cost the most, and that's where states are going to find savings. So you can see that they spent less per person. You can see that that many states chose to serve fewer people, and you can see that many states chose to do both things, which is reduce the amount of spending per person and reduce the amount of people that they were serving. There's also a lot of information coming out about how this bill will impact the overall health system and economy. So when we think about what is in the reconciliation bill, there's 4 major payers for healthcare. Medicare is the largest one, followed by Medicaid. And then you've got people on the Affordable Care Act marketplaces who are purchasing insurance, right? Insurance helps pay healthcare providers. And then you've got people who have employer-sponsored insurance. 4 major payers. This bill negatively impacts 3 out of 4 of them. So that means that some of the payment systems that make sure that doctors and nurses and all of the supplies that clinics and hospitals needs, the things that pay the salaries for the healthcare workers are being reduced. And there isn't, the only payer source that's left is private insurance. People don't stop needing care, and care always costs money. So when you have more people where there is no way that they can pay for their care, or that the payers choose to pay less or choose to pay for fewer things, some of the care that people need becomes uncompensated. And there's only a couple of ways that healthcare entities can deal with people who can't, uncompensated amounts of care. They can go after individuals, and people can end up with lots of medical debt, right? That's one option. But what mostly happens is that those uncompensated costs are passed on to the only payer that's left, which is private insurance. So when insurers costs rise, that usually results in a couple of things. Either the premiums that people who have the insurance policies have go up, or there are other costs like co-insurance or co-pays that go up, because you're trying to make up for lost revenue in Medicaid, Medicare, and Marketplace by charging more to the to fewer people who have private insurance. That means that anybody who needs health care is going to be impacted by this bill, because this bill impacts all of the entire healthcare system and how we've built it. And I think that this is probably a better way to phrase that. It comes from a post that somebody did, and I thought it was a really succinct way of saying it. Medicaid is one of the pillars of how we pay for healthcare in this country. And you're cutting almost $800 billion out of it. And then you're taking another, like 200 billion or more out of marketplace. We're cutting more than $1 trillion out of healthcare in this bill. That's kind of eroding one of the main pillars that supports our healthcare system. And when healthcare providers don't have enough money to cover the cost they have, they're going to raise prices, charge to commercial payers, employer-sponsored insurance, all of those things. And that's going to mean higher premiums, deductibles, and cost sharing. And for some employers who are already struggling to provide employer-sponsored health insurance plans, they're going to look for plans that cover less, or they may decide, maybe I'm not expanding, maybe I'll keep my workforce below 50 so that I'm not required to pay to find employer-sponsored insurance. So one way to think about Medicaid and the Affordable Care Act is it's a subsidy that helps everyone, because it keeps healthcare costs lower than they would be if you didn't have a payer source for all of those people. And maybe you can find a better or more eloquent way of saying this than what I have just talked about on these two slides, but I think it's important. Medicaid is one of the ways that our healthcare system works, and this bill attacks the thing that keeps our healthcare system working. We should expect that that's going to impact anybody who touches that healthcare system, whether they work for a healthcare provider or whether they're trying to use healthcare. There's also been some other reports that have been released, and I'm going to stress that most of these reports are very clear to say we analyzed the House version of the bill, and we recognize the Senate version of the bill makes some of these provisions, more stringent, so that our analysis should be looked at as the House is the base and then add on from there, essentially. But this one really talks about how not only does Medicaid, support the entire healthcare system, it really supports a whole sector of the job market. Again, Medicaid is not money that goes to the individual people on Medicaid. Medicaid is employer salaries. It's salaries for the people who actually do the work. So when you're cutting Medicaid, you are cutting the source of money that pays workers to do the work. And that will mean there'll be job losses and especially in the sector of workers who provide services to people with disabilities. The little graph on the screen shows that actually services for the elderly and people with disabilities, that's been where the growth has happened in our economy in the last 20 years. 2 million, we've added 2 million of those jobs to the labor force. And there's a relationship with adding more jobs as states have figured out that home and community-based services are a good idea and what people want, that you need workers who are providing those services. So this study is saying, hey, there's at least 2.6 million jobs in the home and community-based sector alone that are at risk if you start, reducing the funding source that pays those workers' salaries. and really talks, it makes the connection that like just cutting Medicaid means that you're cutting potentially a bunch of people out of their jobs, and the people who rely on those folks in those jobs are going to be without care. Another study came out this week, again, based on the House version of the bill, that shows, hey, good portion of working America is reliant on Medicaid. About 19.4 million workers in all sorts of industries are on Medicaid as their form of health insurance. In some states, it's about 15% of their workforce relies on Medicaid for their health care. And no surprise to us, about half the people who are working, who are in Medicaid, are employed by small businesses that are not required under law to offer employer-sponsored insurance programs. So, the people who are working for small businesses or are working multiple jobs or are working part-time or are working in industries where it isn't traditionally been a place that has offered employer-sponsored insurance, they're getting their health care from Medicaid. And you can see, they've broken out how many people in different kinds of industries are getting their health care and Medicaid. Healthcare and social service workers, 2 million of them who are working to provide care for people, including people with disabilities and older adults, probably in some of those home and community-based services jobs. They're getting their health care through Medicaid because they're working for small businesses that don't have employer-sponsored health care, or they're working part-time or for multiple businesses and never getting to a place where they work enough hours in one place to get employer-sponsored health care. There are also some other articles coming out this week talking about the other, one of the other pillars of how we pay for healthcare in this country, people who have individual marketplace plans through the Affordable Care Act. There's 24 million people in this country that are enrolled in the ACA marketplace. I think there's about 73 million people in Medicaid. So we're close, approaching, almost 100 million people who will be directly affected by the provisions in this bill, and potentially some impacts on Medicare, especially for dual eligible people who are eligible for both Medicare and Medicaid. This is a summary of some of the provisions in the bill, and many analysts are kind of describing some of the changes that impact the Affordable Care Act marketplaces as ACA repeal by paper cut. Lots of small tweaks that are going to potentially add up to millions of people losing their insurance. Another, and this is a healthcare analyst, real policy wonk place. They looked at the bill from a different angle and projected that the provisions that impact the marketplace, remember there's 24 million people in the who are getting their insurance through the ACA marketplace, that the enrollment might decrease by 47 to 57%, or 11.2 to 13.6 million people. That's half the people who have ACA marketplace plans now might not have them because of this bill and the expiration of the subsidies that keep the premiums low, which will happen at the end of this calendar year. That's especially true in non-expansion states, of which Wisconsin is one. They project a higher range of people who have marketplace plans now who wouldn't in the future. And a lot of that is because the cost of those marketplace plans, it would go up significantly, not only because the subsidies are ending at the end of the year, but the changes that the bill makes are projected to make it harder for people to get in coverage, and people will fall out of the plans. This is important because it could result in a concern that we had about 10 years ago, where the we have 24 million people who are getting insurance out of the market in the ACA marketplace. And a lot of those people are young and healthy and therefore don't cost a lot. So they pay their premiums and they pay their money in. And that, since there's a lot of them, that helps the insurance companies pay for the costs of people who are older and maybe have more health issues. All of the folks that have their premiums that go up, or their coinsurance or other costs go up to the point where they can't afford it, many of the people who might leave the marketplace, we should expect would be those younger, lower cost people. And if they leave the marketplace, that means that it will continue to drive up the costs for older people or other policyholders. And therefore will be in another position where, as costs continue to rise, the number of people who can't afford the plans and drop their insurance entirely, we should project to continue to increase. There's a name for it. It's called the death spiral, where you have the low cost folks leaving only the higher and higher cost people, which creates the premiums and the costs to go up, which means that more people leave, which creates premiums and costs to go up. And essentially what folks worry about is when that happens enough, you end up with the ACA marketplace turning essentially into a high cost, high risk pool that is really not accessible to very many people. There was another report released this week that says, hey, with all of these people who could potentially become uninsured, there are going to be a lot more people who end up with high medical debt. Again, when you have healthcare providers that are not getting paid for the care they provide, yes, they can raise their costs more and try and shift those costs onto insurers, who will shift those costs onto people who hold insurance plans. But the other option they have is to say, hey, you individual who receive the care, we are going to go after you and make you individually responsible. And some healthcare costs are high. So it doesn't take a big encounter for the healthcare system before somebody has thousands or tens of thousands or maybe even hundreds of thousands of medical debt pretty quickly. This report said, hey, these changes that are going to result in people losing coverage are going to mean that the number of families and households that have medical debt as part of what they are dealing with, 5.4 million people are going to have more medical debt. And that a lot of those people are going to have medical debt because they lost their Medicaid coverage or their ACA marketplace plans. Direct relationship. You lose your Medicaid or ACA marketplace plan coverage, you are more likely to get medical debt. And it could be a pretty high amount. Their projection was those folks that lose their coverage could see medical debt increase by as much as almost $23,000. And overall, for the whole country, a $50 billion increase in medical debt. They did have a state-by-state breakdown and looked at Wisconsin. 71,000 people in the state could see their medical debt increase by about $668 million. So again, it just shows you that these changes that the bill is making really ripple throughout any, not only the healthcare system, but through anybody who needs or interacts with the healthcare system. I referenced the Wisconsin article that came out of our event for unpaid caregivers. This is a connection that people at the national level are making as well. So there was an opinion piece that the governor of New Mexico wrote that was published this week as well, and noting that people like yourselves, people who provide unpaid care, are the invisible workforce that is the foundation, not only of long-term care system, I would add to the healthcare system as well. These are the unpaid workers who are getting a little bit of help from Medicaid, generally, to be able to make it all work. And fill in the gaps when there isn't paid care, or on the nights and on the weekends, whenever, Medicaid isn't providing that care. And she did a really good job of connecting. This is the cause and the consequence of what will happen when you take away what little supports people are getting by Medicaid. You are really shifting the responsibility and the challenge to unpaid caregivers, and in an unfair way, and in a way that many people won't be able to manage. And finally, our friends at KFF made a formal study of a point that we've talked about before, that this bill impacts not only Medicaid and the marketplace, but also food assistance. And that a lot of people who are in receiving food assistance are also in Medicaid. 78% of people who are receiving SNAP food assistance are also in Medicaid. And almost 20% of those people are people who are in Medicaid and Medicare, which tend to be very low income older adults and people with disabilities. That's really who the dually eligible population is. And this report was very clear and said, hey, this mega bill is going to result in people losing both healthcare coverage and food assistance at the same time. All right, so that's kind of a big, I told you there were going to be reports and things that came out, and a month after the House bill, yep, we're starting to see a flood of things that are telling us the impacts that we already know about. Obviously, the Senate makes changes, and we will expect that there will continue to be analysis of what do those changes actually mean. And it isn't going to be better than the House bill. It'll be worse. Everything you're doing still matters. Yes, there's still time. The Senate hasn't voted on this. That means there has been no official decision on any of these things. And you are being successful because more people are learning about what's in the bill. And when they learn about what's in the bill, they don't like it. We shared some slides last week about that showed how many people didn't know anything about the bill. And that number is going down a little bit. And in fact, when people hear just the statement, hey, this bill takes from the poorest people and the tax cuts go to the richest people, the support from the bill really flips. It goes from 50% supporting it, you ask that question, they learn the answer, to 61% opposing it. So, the simple messages of 16 million people are going to lose their health care. This is going to impact everybody who uses healthcare, who works in healthcare. This is taking away from the people who are already struggling the most to give tax breaks to the people who don't need them. Those things are very common sense statements that resonate with a lot of people. And so more pressure and continued pressure is necessary to remind these senators how many people are watching their decisions, and to also convey to them that these people who are watching are not going to go away. In fact, they're going to talk to all of their friends and their neighbors and everyone else they can find to help those people understand what is happening and build the base of people who are really not fans of this bill. Another lean into your power, it's really clear that there is less trust in elites, right? I always present a lot of fact sheets because I know that you want them and you love them. We are the minority. You are a group of people who probably knows more about Medicaid than 95% of the country. Okay, so the things that we love, the good data point, the fact sheet, is it a credible source? Those are things that appeal to people like us who trust the analysis of folks who have spent a career studying these things. But lot fewer people are starting to trust those elite sources or engage with them. They may not, there's so much information out there, it's becoming harder and harder for people to know what sources should they trust, right? And it is becoming more clear that people are not trusting their politicians or the government. The good news is, as Americans, we still trust each other. And we trust each other more than some of the institutions that perhaps have been in place a long time. That means that you are a trusted source and that you are essentially the resident hometown expert amongst your peers that people can trust to talk about Medicaid and what this bill means and what it actually looks like when these cuts come home. So part of the work that all of us collectively are going to be needing to do, not only in the coming few days, but in the months ahead, is to really help people connect the dots, to link this bill to the ripple effects that really matter, that people understand apply to them. I've got a few things up here. Maybe you can think of some others. 16 million people being uninsured, higher premiums, no matter who you are. If you have fewer small businesses or fewer workers that are providing help with caregiving, that means there's fewer care options for anyone. If the businesses don't exist, it doesn't matter what your income is, there's no one to hire. Medicaid cuts, you're disturbing a major pillar of how we pay for healthcare in this country. And that means that for a lot of businesses and healthcare providers who rely on Medicaid as a big part of their operating budget, they're going to have to make decisions about what services they can provide, cut services, or even close places. And in areas that have a lot of, especially rural areas, that have a lot of people who are low income, that will mean that there will be fewer options for healthcare for everyone. If you have less in-home care and you are an employer, you will have more people who are going to have a harder time balancing both full employment and the demands of unpaid care when they get less support, right? These are just a few causes and effects that we were thinking about as being something that many people, even if they're not in Medicaid, could understand, but I bet you could think of a few more. And if you can, let me know what they are, because we'll put them in another slide. So in that vein, how do you have conversations with people, your non-Medicaid friends, family members, others? Like, how do you get those folks to understand and get them from point A to point B? Here's what this bill does. Have you thought about what it means to you? Some options. Again, you may have other ideas for questions. Let us know what they are. We always want to share. But we're trying to make a connection. If your local hospital has to close, how far do you have to drive for care? How long would that take you? If you have a lot of people losing health care, what do you think that means for your private insurance premiums? Okay. If you have people who are not able to pay and don't have health insurance and they're using emergency rooms, what does that mean when it's your turn to go to an emergency room and it's already full? What does it mean to the ability for our healthcare providers to serve people well and serve everyone when they have so many people who really can't, don't have good access to healthcare because they don't have insurance. What help besides you is going to be around when your aging relatives need support to stay in their home? A lot of people aren't thinking about that, and it's going to hit folks pretty hard. There's a lot of working age folks in their 40s and 50s who are starting to see elder care on their horizon. Some of those people are also managing young kids, and we're not good as a country to talking about future planning. Lots of people are ending up at the ADRC assuming there's something there and are surprised to find out how little help is available now. What happens when there isn't any help available? When it is only the unpaid caregiver or nothing? It's important to start people thinking about that. And what does it mean if you can't find anybody to hire? Are you willing to step in and be an unpaid caregiver? How much are you willing to do? What are you willing to do? How many hours a week? How long? These are all things that a lot of people who are not necessarily being helped by Medicaid now aren't thinking about because they're not in it. If you haven't seen, PBS has a new series on caregiving. I think I'm through the first episode. It's a multi-part episode, and it's really good. It really does show how many different people, kinds of people are touched by caregiving and the struggles that they have now. So if you're looking for another, thing to watch on your vacation besides Charity Not Change, the caregiving series on PBS is really well done, and I think a lot of the folks that you and I know will relate to it really well. But the reason that they're doing the documentary is a lot of people just haven't been in it yet, right? And there's a lot of people who have never thought about, well, what happens if I acquire a disability? Many of us who have been born with a disability by circumstance or have lived with a disability for a long time, we are used to that as the normal, right? But for lots of people, they ease into a disability over time, either by accident or military service or, a disease that progresses or just aging. And folks don't necessarily kind of understand that what that might mean for their life in a world that has not really put disability services to the forefront as we would say they need to be. Are people willing to wait for services if they have a need? If your parent falls and breaks a hip, how long do you wait? Or could you wait? These are all questions that you can be the conversation starter to get people who are not necessarily, up in arms about this bill to understand that it is going to impact them. And of course, we don't want to leave our lawmakers behind. When you have a senator or a U.S. senator or a U.S. congressperson, it's important to keep challenging them on this bill. It is not an excuse for lawmakers to say, well, we didn't know what was in it, or to keep not answering these questions or pretending that these concerns are not actually things that people should be worried about. These are all things that are very practical that we need to keep challenging our legislators to understand are unaddressed in this bill. This is where the rubber meets the road. When you take $1 trillion out of the healthcare system, you can't expect that there will be no impacts for real people, especially when the Congressional Budget Office is saying 16 million people are going to lose their healthcare, right? And that you're expecting that the way that you're saving money is in fact by people losing their health care, so you don't have to pay for it. So it may feel like the next few days are critical, and I feel like we've said that every time we've had a webinar, and it's always been true. Because the work that you have been doing has really made a huge difference. it isn't going to be over whatever happens in the next week with this bill. You have become really seasoned veteran advocates in the last 6 months, and some of you were before. And I want to make sure that you understand you've had really big successes already. The last 6 months of work, you've made Medicaid a #1 issue. This is still a reason why this whole bill could fall apart. You've prevented the worst ideas that we were worried about in February from being included in this bill, and that is a huge victory. Because as bad as some of these changes are and as impactful as they will be, they are not structurally changing how Medicaid works. They could be changed back, even if they pass in the future, right? And you've preserved a lot of funding for disability programs that were on the chopping block. So you are prepared. You're prepared for the next week, and you're going to be prepared for what's coming next, because there's going to be a continued need of advocacy for the foreseeable future and long time. That's not different when you think about the passage of the ADA, the passage of IDEA, how people went from institutions to not living in institutions. We've had a kind of period where the laws and the protections that we have been able to achieve have been in a static state. We are in a new frame where we're going to have to fight to keep some of the gains that we've had, and we're going to have to fight and have a vision for how the system that we have now that kind of sort of works but needs to work a lot better should look in the future. And just to give you a preview, at some point, most people think that this reconciliation bill will pass in some form. There's still a lot of opportunity to get rid of the worst things in that bill that hurt people like us the most. We may be successful on some of those things, and we may end up with provisions in that bill that states are going to have to implement. So the first thing that happens after reconciliation is we need to pivot to state advocacy, because if this bill creates budget holes and requires states to do things to implement provisions of this bill, it's going to be up to us to lead and drive that discussion on any changes or cuts to Wisconsin Medicaid programs. And you are in the perfect position to do it, and you are well practiced, and we will help find a way to support you in doing that. It needs to be the people who are in the programs, who have lived experience, who are talking to the decision makers about what they need to do and not do. We cannot wait for somebody else to make a decision that they don't understand how it will fully impact people's lives. So be prepared for that at some point, this bill will pass. We will know what's in it. We will know what it means for our state and what the decisions are that our state will have to think about. And we have to be actively in that decision-making process and driving it, not just waiting for it to happen. All right. We'll still need to keep an eye on the federal level, because the 2026 federal budget, which we have talked about and kind of set aside in recent weeks because we've had to talk more about reconciliation, that's still moving. Congress is starting to move the 12 appropriation bills that are usually part of the 2026 federal budget. We've talked about what the president proposed, and there were a lot of things that were in the president's budget that were cuts that would specifically harm people with disabilities and older adults. So we'll see if Congress agrees with some of those cuts or not. We'll see if Congress can get its job done on time, because the next crisis point will be in September 30th. Well, that's when either they have to pass something or the government shuts down. So that is on the horizon. It's not that far away. We're also going to have to keep an eye on the administration. Again, there are lots of things that are happening in federal agencies, and federal agencies who are making decisions about that affect how states can do things, or money that's coming to states that could impact state programs. So we should expect that we're going to have to do that. And we have talked again about how this administration is using its Office of Management and Budget very differently to stop payments that Congress has appropriated, or actually impound and prevent money from coming to states. There's more discussion in the press about that coming to a head in the coming months. So there is going to continue to be many things that disability advocates are going to have to pay attention to if we want to make sure that our voices are being listened to. And you have been listened to in the last 6 months. It may not feel like it, but you've had some amazing victories that many other groups have not. Remember the state budget? Yeah, that's happening too. In fact, it's happening today. There's been a major impasse for the last several months, which is why we haven't talked about it, where the Senate and the Assembly just cannot agree on what they want to do. The Joint Finance Committee actually stopped meeting. Usually they meet and they have a discussion about each state agency and pass a motion to determine what that agency's budget's going to be. They stopped doing that for several weeks. Normally we would be almost done by now. But yesterday afternoon, they announced suddenly that they're meeting today at 10 a.m. to make decisions on all the remaining state budgets. And that includes the Department of Health Services budget, which needs a $1.6 billion cost to continue increase to keep our current Medicaid programs as they are. I don't know what the budget motion that the state is going to, that the Joint Finance Committee is going to consider and pass today, but check your inboxes. We're going to give you a breakdown of what Joint Finance did on special education and what they're doing on aging and disability and Medicaid programs. And we want to do that because, again, you know, you can still be influential in the state budget process, and it's still it will be important because I don't think the Senate can pass the budget with only Republican votes. They will need to work with Democrats. That's something that hasn't happened in a really long time. So that means that it's important for members of the legislature who will have to vote on whatever comes out of joint finance to hear from people on what the priorities in the budget should be. And we think that special education, which is something a lot of people have done advocacy on, as well as keeping our Medicaid programs intact ahead of, potential, cuts to the program, is really important. And there's still process to do that. So we'll try and tell you what Joint Finance is doing today, but just know that that is out there. One of the things that is part of the state budget process, a lot of times the Legislative Fiscal Bureau will write papers, kind of like white papers, like in-depth analysis. And they're nerd papers, but they're really useful in the sense that they tell you, okay, here's what the program's supposed to do. Here's why there is this amount of increase and what it's for, etc. So I thought people might be interested on the Medicaid cost to continue paper, because $1.6 billion to continue doing Medicaid as we do now is a lot of money. And it had some interesting information in there. First of all, Wisconsin's Medicaid programs are facing the same budget pressure as other states, and kind of in the same ways. So that's useful to know that, our cost to continue increase isn't for any different reasons than any other state is finding their costs for Medicaid to rise. And here are the costs why those costs are rising. Why do we need $1.6 billion more to keep Medicaid as it is? There are more people using it, higher enrollment. I believe the figure in the paper is that we have about 21% more folks who are in Medicaid. And some of that is because we have more people who are aging and have spent down all of their private money and are ending up in Medicaid for nursing home long-term care, for example. We also have lots of low-income people who are working and do not have employer-sponsored health care. So there's a number of populations that are leading to higher enrollment. The enrollment increase that we're seeing is not different than other states. But that's one reason why the cost of Medicaid goes up, is because more people are using it instead of fewer. The other cost drivers, prescription drugs. I put optional service here to flag it for you, that this is one of the reasons why Medicaid costs are going up. And it is a place that the state could reevaluate how much they do and what they pay for to make those costs go down. And then really interestingly, again, in alignment with the slides that you saw today, where we were making the connection that home and community-based services is a high cost item in Medicaid and also optional. This little nugget in that paper really shows that, you know, folks who are in long-term care services like family care or IRIS, and I'm not clear if this includes the folks that are in nursing homes or not, but the important piece is long-term care. People who are in long-term care are about 9% of the folks who are in Medicaid. So we have 1.2 million people in Wisconsin in Medicaid. 9% of them, about 190,000 people are in long-term care in some form or another. Those 190,000 people account for 41% of the total amount Medicaid costs. So again, when somebody at the your congressman or senator says, "Oh, you know, these cuts won't hurt people with disabilities," any amount of cuts to the amount of money that states are getting to run their Medicaid programs, well, this is the biggest cost driver. And doesn't it make sense that that would be where states would look, especially since they're optional services, to lower those costs as much as they can, as quick as they can, with this just disturbing the fewest amount of people. The other couple of factors, caregiver shortages, largely that's because the paper is recognizing there's a shortage of workers to provide the care for people in family care and IRIS, and that the legislators' response has been to slightly raise the provider rates for the last several sessions. So they are looking at raising of workers' wages as being a potential reason why the costs of overall Medicaid go up. And then, of course, other impacts where there's maybe higher per person costs and more people using those services. So again, if you're looking for a Wisconsin resource, there is one, and it kind of fits in not only with the state budget question about why do we need so much more money to keep things the same, but it also is helpful in understanding what those federal cuts to Medicaid could mean for the state. So we're not having a webinar next week because some people, including yourselves, deserve summer, and we know it's a holiday week. A lot could happen in the next few days. We're going to do our best to keep on top of it. You know, it changes every 5 minutes. So we will try and put together action alerts as we know what the Senate is doing, if they are voting, where you can watch that vote, what is in the text that is different, if we can analyze it as quickly as possible, and whether the House is taking action next week. You could have a couple of alerts in your inbox, and we'll try and have action steps because we're going to follow and play this all the way through. Even if it gets to the president's desk, we can, then it's a different number to call. There's no reason not to keep advocating at this point, no downside. And a lot of things can change. So sign up for the webinar on July 11th. Hopefully, if anything happens, we'll know what it is by then, and we can have an in-depth discussion of what just happened, or nothing happened, and let's talk about, the next steps there, right? With that, I'm going to stop sharing because I'm a little over time. Are there any questions that did not get answered?
No, you covered everything people had questions about.
There was one request for the actual text of the bills, and I do not have that. So that might be
There is
something-
no text to the bills.
I
I
know,
would like
'cause-
that too.
Yes. That's what I
We
said.
are aligned. Whoever asked for that, I would like that, and I've been it hasn't been released, which is part of the problem. Nobody knows what's in it, and nobody knows what they're voting on if you have a vote for it. When we have text, and if we're doing action alerts, we always try to do our best to link you to the primary sources. So if you want the actual text of the bill, we will try and include that.
Yeah, and someone had posted one of the texts, but the bill has changed. That was
Yes.
originally, so I think there's
Well-
an original bill, and then
What we have is the text that was released by the Senate Finance Committee, which has jurisdiction over Medicaid, and the Agriculture Committee, which is from about a week ago. And that kind of gives you the, here's the intent, here's the roadmap, but we know there have been changes beyond that, that have been telegraphed.